Good afternoon. My name is Scott Snow. I'm the Chief of Police for the City of Reading, and I'd like to welcome everybody today. We're really thankful that you were able to take time out of your busy schedule. Again, we appreciate you all coming, and it's nice to see such a broad turnout because we know that heroin is not just a police thing or a fire thing. It's a community problem. So we really appreciate you all taking your time today to be here. At each one of your tables, you should see a green Lumiere bag, and inside that bag is comprised of resources and papers from our different sponsors and speakers today. So please feel free to take that bag when you leave. Agendas are on your table. We've made this presentation to be quick. That way we can get you out of here, all right, and we're not wasting your whole day. There will be an opportunity to engage with our speakers at the end of the program. So what we would do is, as we have speakers come up and they present, we'd ask you to hold your questions to the very end. We will have a small question and answer period. With that said, unfortunately, Congressman Winstrup's going to have to leave a little early today for that, so we will probably allow for a little bit of questioning then. So to kick this off, I'd like to introduce Chrissy, I know I'm going to butcher this name, Haslam? There we go. Marketing Outreach Coordinator with Lumiere Healing Centers, who is sponsoring this seminar and providing our lunch today. Chrissy?
Thank you, Chief Snow. On behalf of Lumiere, I'd like to thank you all for attending today. We recognize that all of you are incredibly busy, so thanks for giving us some of your time. And we really want to thank all of you that are here that are first responders. We can't thank you enough for what you're doing for our community, and we know that you are bearing the brunt of this epidemic. You are seeing the worst of the overdoses. You are seeing all the deaths that are occurring. You are witnessing firsthand the awful repercussions of heroin. So thank you for continuing to serve us. Thank you for battling the compassion fatigue that we always hear about, even after reviving the same individual time and time again. Thank you for advocating for your communities here today. Sponsoring an event like this is an honor when you get to be around so many upstanding individuals. The green Lumiere bags have my card as well as the Lumiere healing brochures in them. However, what I would really like and ask you all to do is to stop by this table, if you guys could stand up. This is the Lumiere team. They're an incredible group of folks. We have our director as well as some of our staff here. And you might already know about our wonderful facility in Jupiter. However, we're new to Cincinnati. And please take the chance to come over and meet them. We're more than happy to give you a tour of our state-of-the-art facility on Wetherington's Golf Course in Westchester. We offer medical detox, residential treatment, as well as a partial hospitalization program. So please go meet these guys. We'd also like to thank our partners in the treatment industry, American Addiction Center, Ridgeview Behavioral Hospital, Darrell Strawberry Recovery Center, Beckett Springs, Tri-Health, Sober Escorts, Life Worth Living, Butler County Mental Health and Addiction Services, the Center for Addiction Treatment, and the Ridge. Thank you. Lastly, thank you so much to Chief Snow and the Reading Police Department, as well as Chief Wallace and the Amberley Police Department. Chief Wallace, you, Rob, and Anna, and your wonderful team worked incredibly hard to make this happen. Let's give them a big round of applause. And with that, I'm going to turn it back to Chief Snow, who's going to introduce our wonderful Congressman Winstrup.
Thank you, Chrissy. Our first speaker today is Congressman Brad Winstrup. A Cincinnati native, Congressman Winstrup was elected in 2012 to represent the people of Ohio's 2nd Congressional District in the U.S. House of Representatives. He brings with him experiences as a doctor, Army Reserve officer, Iraq war veteran, and small business owner to help Congress tackle the challenges facing Ohio and the nation. In the 114th Congress, Congressman Winstrup has served on the following committees: House Armed Services Committee, the House Permanent Selection Committee on Intelligence, and Veterans Affairs. He's also working to strengthen our military and national defense, help our returning service members transition into the civilian life, and support Southern Ohio's veteran community. On behalf of the group, we thank you, Congressman Winstrup, for your service to our community and our nation, and invite you to come up.
Well, thank you for that kind introduction, and I appreciate you all coming out here today with a concern for our community and for our nation and the situation that we find ourselves in. I'm sure that we would much rather be doing other things, but we're embracing a problem that's very real and it's affecting all of our lives. In 2014, there were 2,500 deaths in Ohio just from drug abuse, half of them prescription drugs, and 400 just in the 2nd District of Ohio that I represent. You know, this is a situation that has brought us all together in so many ways. I have had the opportunity to spend time with those in law enforcement, those in the medical profession, and with leaders of communities that have concern over these problems. And the federal component has a role, but it's really primarily to assist in the local communities to do the things that you need to do or that will work best for your community, and to put a face to the problem rather than something out of Washington. As most of you know, the CARA was passed, Comprehensive Addiction and Recovery Act was passed, and again, predominantly designed to help local communities, to assist law enforcement, to assist in healthcare, and to try and remove some of the stigma associated with this problem, because we've come to realize that this is not just a criminal problem, this is a healthcare problem. I mean, if you talked to me when I was younger about heroin, that was the craziest of the crazies. You know, who did that? You know, that was like Charlie Manson and nobody else, really. But today it's affecting everyone at every stage of life and every social economic component. So we really worked in Washington, what we passed, and Rob Portman, I give him a lot of credit for really pursuing this. It's in the form of grants to work with prevention, to work with treatment and recovery. And it has components to it for Health and Human Services to explore best practices. For the VA, which is a federal entity, obviously, to look at opioid abuse and treatment and report on that. You know, I was always very frugal in my practice with prescription drugs. And I guess I take it as a badge of honor last year when someone came up to me and said, oh, I have a friend who asked me to thank you if I ran into you. And I said, well, why is that? He said, well, she was addicted to prescription drugs. And she came to you one time, and you didn't give her any. And I always told patients, you know, I can treat your acute pain, but I don't treat chronic pain. That's not what I do, and we need experts in that field. And that really is where we're headed. And we've also had a component of how you're evaluated as a doctor by whether you took someone's pain away or not. Well, that to me was the wrong path to go, because then you were just very heavily like, look, we got rid of your pain. That was the goal. But you know what? Pain is a diagnostic tool as well. And it can cover things up when you just eliminate it. So we've changed that. We do have a doctor's caucus in Washington, D.C., made up of about 15 doctors, nurses, and dentists. And so we have an opportunity to engage in a lot of these issues. And that is one of the things that we had influence in taking that out, as far as an evaluation tool about whether someone's doing a good job or not, whether they took away someone's pain completely. Now, there are ways, and you need to be experts at pain management, and I think that we see that more and more today. We also in Ohio have the ORS program, which when I first got to Congress, the ORS program, for those who don't know, allows doctors to see what other doctors are prescribing. But the VA could look and see what other doctors in Ohio were prescribing, but you couldn't see what the VA was prescribing, and it took a couple years before we got that going. And we need to make that more across state lines, because it's very easy. I mean, Portsmouth, Ohio, which is ground zero for so many of the prescription narcotics that existed and the pill mills that existed that are now gone, thanks to Mike DeWine and a few others. We ran them out, but you know, it was easy to be in Portsmouth, Ohio, or be in Kentucky, or be in West Virginia in a heartbeat. The other parts of this bill concern treatment of the mothers and their children. Obviously, we have babies being born under the influence of drugs, and we want to make sure that we're taking care of those children and their parents. You know, in the big picture of all this, there's several components to the drug problem that need to be addressed. If you think about it, you want to stop the flow of drugs into our country. I mean, I think we have 4 good reasons to make sure that we secure our borders better. One is to monitor the flow of drugs and stop the flow of drugs into our country, to monitor disease coming in and out of our country, and obviously for national security. And if we're going to have a legal immigration system, we need to have security. So that's something that really at the federal level we should be dealing on. And then stop it from ever getting to dealers. And then, as you know, local law enforcement, when we've got dealers in the area, how do we shut them down? I think the next component, of course, is the people that are actually involved, those that find themselves dependent and addicted and in this situation, some innocently, and some of them came through recreational drugs and worked their way up, if you will. And now you're getting into the lives of the people that are our neighbors and that we care about. And I think one of the components that we really should focus on a lot if we're going to make a difference in the long term, and I'm not saying ignore all the other components, and I'll talk about that, but is prevention. The sheriff in Adams County, he offers a $500 award for the best essay to 7th and 8th graders in Adams County, and their essay is written on the dangers of opiates, and they're read and evaluated and scored by local doctors. And he's creating an awareness amongst kids. And when I've been out with these kids, and he has a boot camp with them as well, a couple of the kids came up to me, 2 that I can think of, and they said, both my parents use, but I'm not going to. And he talks to them about being the generation that's going to solve this problem. Because if you don't start, then the problem goes away. But in the meantime, we have a lot to deal with. And you look at the situation, you and law enforcement, medical personnel and emergency departments, EMT, you deliver Narcan. Well, you kept the heart beating, but have we saved a life? And we haven't really saved a life if they go right back. And as many of you know, it may be later the same day, you're doing the same thing. So we really need to focus on how we can get people into rehab to break this cycle. And it's a hard thing to do. In an emergency room, they can bring them back and just say, do you want treatment? No, I'm going right back out, doing what I do. And I try to share this with people to talk about this dependency. I said, imagine if you hadn't eaten in 6 or 7 days, what would you do for food? You'd break into someone's home. You'd do whatever you need to do. And that's what we have to realize, that the power of this addiction is so strong, and that makes it even more challenging. But we see a lot of positive things happening. We see people, some can go cold turkey, but most people need medical assistance through the process. And I think that it's always successful when you have a former user part of that process who can sit there and say, I know what you're going through, I know what's taking place. And we see that in some of the programs that exist. And when I've had that opportunity to see that, and I talk to the people that are in the program, they say that meant as much to them as anything else. But then the final component too is if you get someone into rehab and you can break this cycle, where are they going next? And I think that's one of the challenges that we have. If you can't get a job, if you can't have a purpose in life after this because of your record and because of this history, it makes it very difficult to stop the recurrence. So every one of these components on this track need to be addressed. And if we don't, then we really have a hard time succeeding, but it's a lot to take care of. And that to me is why I think so much of it has to happen in a local level where families are involved with the people that we're talking about. And so that we have an understanding and a knowing of the people that find themselves in this situation. I mean, I know professional people who had a problem, a medical problem, and started taking prescription narcotics and then found themselves addicted and going on to other things. You all know that that's not uncommon. That takes place today. So we've got to have opportunities that exist afterwards. I look at programs like Cincinnati Works, where if you have a record, they're going to work with you and they're going to help you get into employment. And it's not just fill out this form and go to work and we'll see you later. You become part of this family. That's for people a record of any type. And so those are the types of things that I think we need to engage in if we're going to have results in the long run. We all get up each day with challenges in life. We all care about our communities. That's why you're all here. And I'm hoping and praying that it's so often we do in America, we solve problems. And we have bumps in the road and challenges come our way. And we come together as a people and we get things fixed. So I appreciate every one of you being here today. Look forward to feedback any of you can give us at any time, because no one person's going to solve this. It's going to take all of us. So thank you for being here today and appreciate all your efforts. God bless.
Tom has been with the Norwood Police Department for 26 years, and the last 17 years have been on various task forces, including the Criminal Investigative Section, the Norwood Drug Task Force, and again, he currently serves as the Hamilton County Heroin Task Force Director. Tom?
I kind of wanted to start with a video. It happened in Norwood on the 27th of August, and it was during the Hope Over Heroin March. And it does have a positive outcome, because this young man who's the same age as my son, we were able through, and we have parts of our HEART team from Norwood here, the fire chief and our health department nurse, we were able to get this young man into help, and he's in a Suboxone clinic. But go ahead. It takes about 30 seconds for the audio to kick in on the body cams. I'll just give you the play-by-play then. So this is the first officer on the scene. He's putting together the Narcan kit. The health commissioner gave those to everybody here in Hamilton County, so thank you, sir. Okay, now we got the audio. This young man took 2 doses of Narcan to revive him. If you hear that, a lot of times on the death scenes that we go to, they'll describe that they're snoring when it's actually their respiration suppressed by the opiate.
He might, no, he might come up, might not, there. He's check his pockets or anything. They're coming.
So there you see the success. And it was kind of cool that the people there were applauding and thanking the police and the fire for their service. So that's just a good Narcan success that, and it's kind of the problem. We were able to get him the help that he needed, and hopefully he continues to do the right things going through. I think he's going through Brightview, which is a clinic in Norwood, and Coleraine. So my PowerPoint and my presentation is really for the first responders. Right. So kind of just to give you a little bit of the numbers, in 2014, we had 177 heroin-involved deaths compared to 87 homicides. Obviously, there was extensive law enforcement efforts to investigate these murders and homicides, but absolutely no specialized units for overdose and overdose investigations. Just kind of give you the numbers. These are from 2015, and you can see that just in fentanyl involved, we went from, well, we'll bounce around, but in 15 we had 255 fentanyl involved deaths, 216 heroin involved deaths. So Hamilton County is right in the center of this problem. Fentanyl began to be introduced, and we saw basically it increases the potency. It's obviously everybody's heard all those numbers. In 13, we had 7 overdose deaths with fentanyl present, and in 14 we had 80, and then in 15 we went up to 255. So, and this just kind of shows you that where there was 502 fentanyl-related deaths in the state of Ohio, and 80 of those that year were in Hamilton County. As you can see, we led the state with 80. We did also last year with those 255. And in 2014, if you think about it, there's 88 counties in Ohio, and we had 16% of the fentanyl-involved overdose deaths. That's a ridiculously high number. And I'll steal from the coroner, and I know there's some of the investigators from the coroner's office here. But the introduction of fentanyl makes a lot of sense because, with heroin, you have to grow poppy, you have to make it into morphine and then make it into heroin. With fentanyl, you can directly order it from China or get a good chemist and get the right chemicals and make it here. So, but the bottom line is that people on the street really don't know what they're getting. They don't know if it's, everything's called heroin. They don't know what they're getting. It's a mixture of everything. So, the Chiefs Association, which I use their logo up here, and the early part of 15, we're trying to come up with a solution on how could we do something different? How could we beat this epidemic? Obviously, and you'll see in a couple slides later that it hits every jurisdiction in Hamilton County, from east to west, north to south, the city, Cincinnati, and everywhere in between. So they created a committee. Out of that committee, the Heroin Task Force was also created, and also that committee jumped into another venue of the coalition, which Kelly's here from Commissioner Dieter's office, she's like our glue that holds us all together on that. So thank you, Kelly. Go ahead. So our mission of the task force is basically we're a multi-jurisdictional task force that basically all of our focus is on investigating the source of supply of the heroin that led to the death or to the overdose. We are the investigative arm of the supply reduction of the Greater Heroin Coalition. So part of that was, and we went up to Cleveland a couple of times to kind of look what they were doing. They were doing a similar thing, but our Chiefs Association developed this protocol. And the protocol has some really kind of important, go ahead, thank you. It establishes the Heroin Task Force. And then something different, and I saw it as on my job in Norwood a lot of times, is that we didn't necessarily treat them as crime scenes, but all suspected overdoses were treated as crime scenes and processed accordingly to those standards. Another thing, a part of this protocol, was establishing rapport and avoiding rushing to arrest. These are a very volatile group. They don't trust the police, so it was really important for the first responders to establish that rapport. And then we have a ton of partnerships, but highlighted on this protocol was the coroner. There's a couple of the investigators here, but there are 5 of them, and they work with our 8 investigators every day. They have a different investigation they're doing, trying to determine the cause of death, and we're trying to determine the source of supply to the heroin. But and then the prosecutor here and the U.S. Attorney's Office, it was important too. We've been able to get assigned prosecutors from the prosecutor's office and the U.S. Attorney's Office. And then one of the really unique things that's not done anywhere in the state that we're aware of yet is it mandates the heroin report. Everybody that's a police officer understands it's on the MDC, and it's as little information as the victim's name, if they survive or even if they die, all the way up to the dealer, their number, the location. This stuff is all sent through our CIC to the Fusion Center. We have an analyst there, and they send out a weekly and a daily report, and they also share it with our partners and the other parts of prevention, treatment, and harm reduction. And it's really, we could do a whole day on the, am I right, Tim, about all of the overdoses and the data there, but it's really, we can really see where things are happening, where the bad dope is, and so on like that. So our task force currently now, we have 9 people made from the Sheriff's Office, Cincinnati, Norwood, BCI, and the State Highway Patrol. We began training in mid-May, and then we began investigating overdose deaths and overdoses June 1st of 2015. Put that in blue, that looks horrible, sorry. So in 2015, it took a while to get everybody in Hamilton County and, with 47 different police agencies on board, but we investigated 53 overdose deaths. And as somebody that's been on the management side of investigations, closed 9 by arrest is actually a horrible number. But these cases are difficult. And, you don't always have the key pieces of evidence you need. We did 8 heroin drug-related investigations, and we did 9 non-fatals. 9 non-fatals, basically, somebody overdoses and they have to be revived by Narcan. One of the things we've learned as we've grown is the prosecutor's office had to get a expert witness to say that when they're revived with Narcan, that makes for serious physical harm, so we can get the corrupting another with drugs charge, which we've had a lot of luck with that. So there's the 15 deaths by jurisdiction, pretty much, as you can see, pretty much everywhere, east to west, north to south. So far this year, and I haven't done our October statistics yet, but we've looked at 113 suspected heroin overdose deaths, and I will tell you, we don't go to every scene. We only go to scenes where there are some bits of evidence, whether it's the drug packaging or the cell phones, but our numbers are obviously way up for this year. And then just recently in September, we adopted 22 death cases in August 19, which is, we've been averaging about 9. So we've been really getting slammed, and that kind of goes with when the carfentanil was seen in the area. Okay, sorry. So I just wanted to give credit to the people that are on the task force because it's really important. We got 1 sergeant from the sheriff, 2 detectives, 2 Cincinnati detectives, myself, 1 agent from BCI, which is Josh Schlee, and then we have a sergeant and an investigator from OSP. We have a dedicated Hamilton County prosecutor and a U.S. attorney, and then we are actually going to have a DEA agent assigned by the end of this month, hopefully by the 1st of November. So I wanted to get into, since this is first responders, some of the impediments, if you will, of what we're seeing. And almost every crime scene you see is cleansed, whether it's family. People are still, they don't want to acknowledge that their relative has a drug problem. So we see that a lot. We see a lot of uncooperative witnesses and victims. They're avoiding the police most of the time, so they don't really want to hang out with us and tell us really what happened. And then with them being addicted, my guys are really struggle to keep them online from witness stage to prosecution to making them appear in court. And then obviously whenever you're working drugs, you get trouble with multiple nicknames and cell phones and use of rental cars and stuff like that. And then we do some of the law enforcement practices we see kind of can be problematic is sometimes that they just don't identify the scenes as an overdose death scene. And I kind of break these down in a few slides, and I got actually slides from deaths in the last month or 2. And then fair to identify evidence of value, because there's always usually a lot of evidence on these crime scenes. And then obviously we can always improve cooperation from witnesses and people that survive after being Narcaned. And then the information sharing. Our guys the whole county-wide, the officers have done a great job of writing these heroin reports, and I'll touch on that a little bit later on how we're seeing these really work. I'll skip to the second, because really no, I'm sorry. We've seen a significant number of overdoses with the carfentanil and the really powerful fentanyl from people snorting. So a lot of times when you go to a scene, you're not going to see a needle, not always, but we're seeing a lot more people die from just ingesting the heroin through snorting it. And I touched on this briefly too. Even the parents are always embarrassed that their child died, and sometimes they will clean up the crime scene, and they'll remove syringes and spoons, and they'll hide them in closets and stuff. So, and this is one this was actually from a death in August, and this is just where the lady was snorting her heroin and died. And this was a death that my people investigated. And then the one thing is the key on heroin packaging, and what we have to prove when we go to trial is that it's the packaging of last use. A lot of times you'll see tear-offs, and I actually have some slides of what they're using now to sell the heroin and how it looks. But you go into somebody and they use a room in their basement or somewhere where they use all the time, and there'll be hundreds of tear-offs and paper folds all over the room. And then something I wanted to talk about too, and the coroner will address this. The needles do nothing for us as far as tying the case back to the source of supply. But we started mandatory testing it probably 2 months ago because we wanted to identify how much of the carfentanil was in the area. But really needles have no evidentiary value to what we do. And you can't really see this that good, and if I had a pointer, I would show you. This was a death over in Cincinnati in District 3, where the packaging of last use in the guy's hand is the drug packaging and the needle. We don't see that very often, where all of the elements that we would need to try to go back are there. And this is another one. You can't see the deceased is on the floor just below the counter, but you have a spoon, you have a cap of the needle, you have the packaging, the water that they use. So this was kind of an ideal situation too. And like I said in this slide, it's rare that you go to a scene where everything is there, and the cell phone, which you can see to the right. And this is one that's more typical. You'll see multiple bags of the pack. We're trying to find the packaging of last use, and you don't see it there. So. So talking about building rapport, some of the successes we've seen basically are the first officers on the scene. Building that rapport, somebody that's revived with a Narcan, getting them to become, whether it's an informant, whether it's just a witness on a case, a cooperative entity on our end. And I know the chief and assistant chief of Springfield Township are here. We just had a really good case that started there. We've had some in District 3 and 4 recently, and Norwood. And basically the officers connecting to that victim that makes it our job to be able to hold the seller accountable that much easier. And then we get into family members, and we had a case the beginning of this year that started in Claremont County, and if it wasn't for the dad, we would have never been able to go anywhere on it. But they know a lot of information on the death scenes. A lot of times they'll drive them. They know where the spots are, what the dope boys, what kind of car he's driving. They let them use their cell phones, so they save those numbers a lot of times, so they know where those guys are dealing out of and how and what they package it. And then I have a death from earlier in October in Norwood where the mom paid for the cell phone bill and she's given me everything. So it's really important to build that rapport with the family and with the parents. And then the other thing is they have a lot of influence on people that use or that are associated with the deceased that can make cooperation really important. Then you look at the heroin report, as I guess everybody's familiar for the non-law enforcement people. It's on the RCIC. It goes directly to the Fusion Center. They are our partner in information sharing. They also have our criminal analyst. they do more than just put out the daily and the weekly heroin reports, but I wanted to put their number and Casey's email up there. If you ever need anything, if you're working a case where, I see my friends from Sharonville over there, where it involves something in one of their many hotel rooms, and all they have is a phone number or something, call Casey. She can get you any of the information associated with that phone number, or email her. And then I want to talk about how important, and I'm not really whining to all the police officers here in the room, but how important that database on that heroin report is. But it's kind of highlighted on this case here. A guy died in Mason from an overdose. We were contacted, and if it wasn't for the officers putting all the information, a lot of times you might have that the seller was G and this is his phone number or whatever, but if it wasn't for all this officers in this county developing this database, we wouldn't have been able to, because our task force officer was able to identify 4 other non-fatals in Cincinnati and Alexandria as a result of people doing these heroin reports. So, and that information again is available to everybody through the Fusion Center. And this is proof, I guess you could look at it that way. This is the indictment from that case, and it's all basically as a result of this heroin report. And really kind of what we do is all what the HCPA motto is, which is cooperation and operation. We couldn't do it without our partners, with whether it's the coroner, whether it's the health department, whether it's the U.S. attorney, whether it's the prosecutor, anybody that you've heard me talk about, it's the cooperation that makes this work. And then, Amy, where are you at? Amy O'Grady, we were lucky from the Attorney General's office. Our group was able to get the Law Enforcement Group Achievement Award. I'm not bragging about that, but it was nice because what we're doing is different. Nobody in this county, in this state, is doing what we're doing that our Chiefs Association set up. So it's a good thing. Then I wanted to get into, and I'm running over, I guess, or close, but kind of how is heroin packaged now? And some of this is from the internet, but most of it's from our cases, from people that have died or not. So, and that's basically the same way that crack was packaged years ago, and we see that a lot of times also. In the bundles, we see a lot of paper bundles. This is just one from the internet, but you'll see some more as we move on. And that's kind of the one thing I wanted to address on this slide. Heroin has no given color. It used to be all sandy, and now it's brown, it's gray, it's white, it's got flakes in it, it's got all kinds of different stuff. So there's no consistency to the heroin color anymore. This is a death, and it's, in a receipt, you see a little bit of the flakes in there. This is one that our guys handled, but you see a lot of it, depending on the area, packaged with the paper folds. Another paper fold, and that was in a car where the guy died in his car. This is another just example of a plastic tear-off, and that's what we call them, tear-offs or whatever. And this one I wanted to be, this is a case for, I know a lot of the guys that they're out on the street see this, but once they use their heroin, they will also rinse it, shoot that up, and that's where you'll see needles laying around that you can get jabbed with. So be careful when you see those. And this was actually a UC student that died not too long ago, and just don't assume that when you find that first heroin packaging that he doesn't have one hidden in his sock, because this guy had obviously bought 2 different packages of heroin. And then I was talking to our supervisors down there and wanted to kind of give some suggestions, and I know that the AG's office put this out, but don't ever field test the heroin. You don't know what's in there. That carfentanil it hurt some SWAT guys up in the Northeast. So, if anybody's field testing, don't, please. One of the things we've done in our evidence processing room downtown is we put Narcan in there and we make them go in 2 at a time because we just want to use good practices there. We're recommending everybody wear their gloves, obviously, and their mask and the eyewear. This stuff's just dangerous. It'll kill you. And one of the things too, we have a lot of luck on DNA on all those packaging that I showed you. And just don't assume, even if you do a non-fatal overdose, that you don't notify the heroin task force on. Send it up for DNA. You never know. Test it. Another thing we get a lot of times is people will call us and say, I've got somebody here that overdosed, or they're and they want help. And we partner with Addiction Services Council, that 24-hour hotline, 281-7880. They answer it all the time. We work with them through the Norwood Heart Team, and Nicole Rain does with their QRT also. And if you look down there too, Inject Hope, which is the Hamilton County Heroin Coalition website, which is now regional. It has all kinds of other resources out there, and it covers 15 counties. So we get calls on that at least once a week. What do we got to do to get people help? And if you can't find it there, you're not going to find it anywhere. So, and then if anybody has any questions, there's my office number downtown, 946-4379. There's my cell. Can you see my emails, tfallon@gcfc or Norwood Police. The duty phone, anybody that doesn't know that, our supervisors carry that. I luckily don't. But whenever you have a suspicious overdose death or whatever, just call that and we'll coordinate getting somebody there to assist you. And I will emphasize, we will do as little or as much as you want. Some agencies will just want us to help them with the investigation, and then some agencies want us to take it over, and we do anywhere and whatever you guys need. So if you ever have anything, call that 400-7267. And that's it. So thank you.
Thanks, Tom. At this point in time, we're ready for lunch. So what I would ask everybody to do, if you wouldn't mind, is just bow your head and let us say a small prayer before we eat. Our dear most heavenly Father, we thank you for this opportunity to come together as a group to battle this epidemic that's affecting our communities. We ask for your guidance, direction, and to help us in our daily endeavors to fight this problem. In your name we pray, amen. Please feel free to continue with your lunch. We want to make sure that we stay on time and we get you out of here by 1:30. Our next speaker is Commissioner Dennis Dieters. Commissioner Dieters currently serves as the Vice President of the Hamilton County Board of Commissioners. Commissioner Dieters was appointed to the board in January 2016 after serving 6 years as trustee in Colerain Township, one of the largest townships in the state of Ohio. In 2015, Colerain Township instituted the county's first quick response team to address the heroin epidemic. Through a partnership of law enforcement and treatment providers, overdoses in Colerain Township have been reduced by 1/3. Commissioner Dieters currently serves as the chair of the Hamilton County Heroin Coalition, as well as a member of the Stormwater District Oversight Board, the Downtown Cincinnati Inc. Executive Committee, and the REDI Cincinnati Executive Committee. Commissioner Dieters also volunteers his time with Operation Legal Help Ohio to provide free legal assistance to veterans. So if you would please welcome Commissioner Dieters.
Good afternoon. Thank you for having me, and a big thank you to Chief Wallace and his team from Amberley Village for putting this event together. I think it's a statement on how our county and our community is coming together on an issue that I think is tremendously important, and really appreciative of the opportunity to present on what we're doing from a county standpoint to deal with this epidemic and how we can work together. By way of an introduction, I became commissioner in January. As my introduction was presented, I was a trustee for 6 years in Colerain Township, and probably sitting in a lot of your position dealing with this epidemic and questioning how we're going to deal with the resource drain. And that's really what it comes down to for me at its heart. Excuse me, those of us in local government dealing with how to manage a complete diversion of resources in many cases to the overdoses, first response that is, generally speaking, not what our priority is as governments, as police departments, as first responders, is to be dealing with a massive health problem on the local level. So it's incumbent upon us, and when I was a trustee, we looked at it that way. How do we deal with getting our resources back to being used where they need to be, and getting our first responders back to doing their job? I understand from a basic standpoint, the fatigue, first responder fatigue that is occurring as it relates to this epidemic and how we're having to deal with that. And I think it's part and parcel to my job as commissioner and chair of the Heroin Coalition to start to find solutions to provide relief to your communities as it relates to how these overdoses are being managed, how people are given the opportunity to get out of the system. I'm also an attorney in private practice, so I understand the burden that's being presented on our court system. If you talk to our judges and our probation department, our sheriff's department, the jail system, the drain is there as well. So this epidemic and this problem has caused a problem across the board that I think we need to get ahead of, because to some extent we weren't ready for it. And we've seen the explosions and overdoses over the course of the last year. That was something that I know all of you have seen and have been watching that trend. But from a local government standpoint, it's incumbent upon us to find some real solutions. So some basics, some statistics that you may have recognized. 10,000 heroin addicts come through the doors of the Hamilton County Justice Center. It's 20% of the jail's annual admissions. We estimate that number from 2014 was probably higher in 2015 and unfortunately probably higher as a trend this year. According to the coroner's office, we had 198 heroin-related deaths in Hamilton County in 2015, up from 177. Total drug overdose deaths were 414, including 238 fentanyl-involved deaths. Fentanyl is the strong opiate painkiller we're dealing with on the streets now, and it's frankly ravaging our communities as it relates to having to deal with the overdoses, which are more intense and require more assistance and more intensive treatment at the scene. In August, we experienced an unprecedented spike in overdoses that challenged our first responders, police officers, hospitals, and treatment resources. Over 130 overdoses in 10 days. That's a 25 to 50% increase in overdoses that we usually see based upon that trend. And it laid bare the challenges we have in our current systems to track bad batches of opiates, to find the distributors and help those involved who have overdosed. Another statistic that I always cite and I find important to share is the unintended consequence of this addiction on the countywide resources. For example, we learned that 70% of the kids involved in our child welfare system, these are babies, age 0 to 1, are there because of heroin and opiate addiction in their family. Some of them are also addicted themselves. It's also a 17% increase this year in the amount of children that are in foster care, and I think we can unfortunately attribute that to what's happening as it relates to opiate addiction. So what are we doing? What are we doing to give you all some relief from a local level? This type of problem requires collaborative action, and we need to work fast. Last year, the commissioners created the Hamilton County Heroin Coalition, which is a partnership of public health, law enforcement, treatment providers, and prevention experts to develop and implement immediate long-term action steps and collaborative action steps. You can see many partners on the screen. Some of them are in the room today. I know you heard from Lieutenant Fallon from Norwood. He was here earlier. He's still here with our task force. Tim Ingram's in the room, Pat Tribby. Those are the components of the coalition that I think are going to drive this solution and drive us back to doing what we need to do as a community and back to being able to get back to police and first response that's based in our basic needs. 4 key focus areas that the coalition is dealing with: prevention and public awareness, which is educating the public, especially our youth, who are extremely at risk, especially in parts of our community where there's significant drug abuse and addiction in their parents. Harm reduction, reducing the number of diseases, unintentional overdoses, and deaths in our communities. Drug abuse is a drain on our public health system. Law enforcement resources, whether it's to treat hepatitis C, diseases caused by needles, or the cost of responding to drug overdoses by our first responders. Supply control. Through partnerships with local, state, and federal law enforcement, we must reduce the supply of drugs on the street and keep our neighborhoods safe. This is our Heroin Task Force. And finally, treatment, which is the final piece of this that is most in need of attention. All of our work in prevention, reducing crime, and reducing overdoses is useless unless we connect people with appropriate treatment. Here's what we've done. At the county, we quickly learned that many individuals and their families didn't know who to turn for help. We heard frustration time and time and again from parents who picked their son or daughter up from jail or from the hospital after an overdose and didn't know where to go for treatment. We created a one-stop website, injecthope.com. This is a regional website because it's a regional problem. We're cooperating with Northern Kentucky, bringing on members to our board to collaborate with Indiana as well. On the website, you'll find information on the heroin epidemic. How do you know if your loved one is addicted? What can you do to educate your children? There's also an anonymous tip line to report heroin or drugs in your neighborhood, 352-DOPE. The county's purchased Narcan to ensure every police, fire, and social service agency in the county has access to this drug. For those of you who don't know, Narcan, and most of you know, can reverse an overdose. Distribution began earlier this year. 5,000 kits distributed to police and fire agencies across the county. To be candid, the widespread support of the use of Narcan shows how far we've come. There was a obvious trend where people were concerned, why will we give this? I think that most of those in first response, though frustrated, though fatigued from this, understand that this is still a life-saving effort. The death of a loved one by drugs is devastating to a family. I think administering Narcan is something that's important to save lives, but we're not doing our job unless we connect people with treatment. And that's what the coalition needs to focus its efforts on. Talking with first responders who are dealing with this in most of their daily life, spending most of their time with overdoses, we have an obligation to get them back to work. And that's what we're committed to as it relates to saving lives, but continuing that process. You can save a life temporarily if they're addicted to heroin. You're not really saving their life unless you connect them with appropriate treatment. Speaking of law enforcement, I can't say enough good things about our police and fire partners in the coalition. As many of you know, drug abuse breeds crime, unsafe neighborhoods. In one unnamed Hamilton County community, 100% of the property offenses were drug related in 2015. So it's a tremendous problem to combat, and the residual effects are frightening. Use of law enforcement's partners to proactively tackle this issue head on is important, including our Sheriff's Regional Narcotics Unit, the Heroin Coalition's Law Enforcement Task Force, and as Lieutenant Fallon talked about, those efforts are tremendous to getting the supply of drugs off the streets. We have 10 investigators housed in county and growing. That's in a partnership with our county sheriff, who's been a tremendous asset as it relates to providing a resource and leading on this fight. We're also utilizing the Greater Cincinnati Fusion Center, which is a regional system of law enforcement agencies that can access and share heroin-related data, such as arrests, overdoses, and crime. This collaboration is critical, as heroin knows no political or jurisdictional boundaries. The Heroin Task Force and the Sheriff's Department also encourage the use of the tip lines to report heroin through Not in My Neighborhood initiative. Chief Simon has been instrumental in making sure police and first responders distribute Revive cards, which are the business cards seen on the screen that encourage individuals to revive with Narcan to contact the crisis line to get help. Treatment's key. Connecting users with detox, treatment, and recovery they need is the final step in the cycle to remedying this epidemic. Hamilton County is on the leading edge through our court systems to provide innovative treatment in lieu of sentencing that overcrowds our jails and doesn't address the root cause of crimes as a result of substance abuse or mental illness. It's a revolving door otherwise. Through our drug court, veterans court, mental health court, and change court, Low-level offenders are connected with treatment and resources they need to address their addictions. Improvements are being made to adapt to the outgrowth of heroin and opiate addiction. The coalition is working with its partners in the Mental Health Board as well as other providers in the county to champion a treatment plan for increasing, improving, and reprogramming resources for detox beds, inpatient, outpatient treatment, and recovery services. Ongoing resources for treatment will likely be the most expensive facet of the coalition's work, but we can't ask police and public health officials to do their jobs without filling these missing resources and treatment. Organizations like the Cat House, the Talbert House, First Step Home, and others provide exemplary services, and it's important we find ways to fund beds and the outpatient services necessary to get these users clean. In 2016, we've approved an additional $1 million in county budget funds, which is unprecedented, to fund treatment, and we'll continue to evaluate our levies for additional treatment resources to devote to the heroin epidemic. I intend to keep funding for treatment as a priority in the 2017 budget. I also wanted to briefly highlight an effort that I was able to participate in as a trustee in frankly some moments of despair as a local government as it relates to how to deal with this epidemic, questioning how we do our job as a community and how we can improve that service and sort of break down some of the barriers as it relates to a police officer and a firefighter to be able to get people out of the cycle. And that's an important effort as it relates to helping people, but it is also an important effort for our first responders who are visiting the same houses or the same neighborhoods repeatedly. So in Corwin Township, we developed a quick response team, which was an innovative, successful initiative that we hope to replicate in other communities. We've done that in Norwood with success. We announced, I along with Sheriff Neal, announced a countywide effort as it relates to doing a countywide quick response team. I hope to roll that out in the near future. So what happens in these response teams is you get a specialist, addiction specialist, first responder, firefighter, and a police officer who are dedicated to following up with someone who is overdosed. And ultimately, when trying to get someone help, that personal connection goes a long way. There's a small window of opportunity as it relates to getting someone in a position of treatment. What we've seen in Corwin Township with our follow-up is a significant reduction in overdoses in the first year that we've had this effort, as well as 8 out of 10 people who are connecting with our quick response teams getting into treatment. And that's a tremendous opportunity. The outgrowth of that, and I think that this is something more anecdotal than a statistic, is that the dealers on the streets recognize that Corwin Township's police, Norwood's police, those police officers, first responders that are involved in these quick response teams are paying attention to their customers. And that has a deterrent effect on heroin in your community and people bringing heroin in your community, because there's a specific attention being given to this problem. And I think that's why we've seen those models work. It's not only a demand issue where we're getting the treatment that people need to connect with, it's also a supply issue where we're pushing dealers out of communities. This is something I'd like to continue to replicate, and that's why Sheriff Neal and I are pitching this county-wide, and I hope to be able to fund that with the buy-in from a local community that is serviced by our Sheriff's Department to continue the momentum as it relates to quick response. Just last week, Hamilton County Heroin Coalition announced the launch of a community advisory board, which will consist of recovering addicts, family members, and friends of addicts, as well as faith-based organizations. I thought this was an important step and a missing piece to our coalition. Obviously, we know that this is a problem that is affecting families, and when you get moms involved and dads involved that have been touched with this problem, I think we start to move the needle as far as perception, as far as it relates to being able to get community buy-in to get on top of the heroin problem. Our first meeting of the Community Advisory Board will be in November. We expect to see a great turnout based upon the number of people that have already signed up since we announced on Friday. I know many of you are interacting with these families one-on-one during your emergency responses. please feel free to direct them to injecthope.com, our website, to connect them with, as a possible candidate to be part of that effort. I appreciate you having me. I think there'll be an opportunity for me to answer questions later with the panel. But on behalf of the county, I can tell you that I understand what local governments are dealing with as it relates to heroin. I want to make it clear that it's my intention to lead on this issue. And any of you who need me as a resource, please contact my office. Thank you.
Continuing on, we'd like to introduce the Attorney General for the state of Ohio, Michael DeWine.
Manslaughter. We have, as law enforcement officers, have to change our mindset. These are no longer accidental deaths, these are homicides, and we have to process the crime scene as such. Some of the big things that we cover in this training is contamination control procedures. We're collecting DNA evidence at these scenes oftentimes, and it's easily contaminated. So we want to make sure that officers going in there are wearing gloves and they're protecting against contaminating that scene. We also want to show them how to effectively document that scene. So doing photographs, doing a rough sketch of the crime scene, so we can effectively show that to the prosecutor, to a jury later on, and let them know what that scene looked like. We really want them to focus on the packaging that the drug came in. We're looking for DNA evidence or fingerprint evidence on those items. And we want to help them focus in on the specific evidence that's going to identify the dealer and also tie them to that drug that was used in the overdose. What do we have? Got the victim's cell phone here, probably going to be important. So our ultimate goal is to identify the dealer, and probably the best way is to use the victim's cell phone. Oftentimes drug deals are conducted with text messages, phone calls. We can use the victim's phone to then track back to that dealer, find out who that dealer is, and then tie them to that specific heroin.
When we arrive on scene, typically all other bystanders have left the scene after calling it in if they've called it in at all. So the phone can sometimes be our only witness. And fortunately, it's a very good witness of evidence of these circumstances surrounding that person passing away. We hope to find text messages to and from the victim to attempt to ascertain who it was that they spoke to before they passed, and also to try to determine where they acquired their drugs from. Also of interest is their internet history, which is also stored on that device, which can contain additional information regarding how they acquired their drugs. We'll also look at their location information, where we can pinpoint where they were in the days and hours prior to their death. As a support agency, BCI is always there, ready and willing to help all local agencies that might need our assistance in recovering this evidence, subsequently processing this evidence. Any kind of paperwork that needs to be filed with internet service providers, cell phone service providers, companies such as Apple or Google to obtain additional information that can be of use in these cases.
Without the proper collection, we're not going to get the physical evidence that's going to tie the dealer to the heroin that was used in the overdose. It is a team effort. It includes the prosecutor, the medical examiner, the coroner, law enforcement, and all different types of law enforcement investigators to come together and prosecute these and investigate them properly. We've offered this basic evidence collection training several times throughout the state, but we are planning to offer 4 regional trainings throughout the state coming up in the near future. And it's an opportunity for local law enforcement to get that basic training to collect the items properly and to investigate these crimes properly.
Well, thank you all very much. I want to thank our 2 chiefs for doing this, Chief Wallace, Chief Snow, and the Lumiere Healing Centers for putting on this session. As you saw, this is kind of a preview of a course that we offer. We're going to be offering that again in January. We'll continue to offer it periodically. I think more and more departments are starting to get interested in looking at these overdoses from the point of view of not just the tragedy, but that there actually was a crime that was committed, and try to link that individual who sold the drugs to the deceased. So we encourage that. The Attorney General's office, as I said, we We have a course specifically designed for local departments who are going to take on that responsibility to do that. It's one of those things you hope you don't have to do, but the reality we all live in today is that this is hitting every single community. Let me give a couple statistics, and Commissioner Dieters talked about it in Hamilton County. I think did a very, very nice job. Let me tell you a little bit about from our point of view. We've seen the pain meds go to the heroin, go to the fentanyl, go to the carfentanil, and each one is progressing much more dangerous, much more potent. And even starting with heroin, we think that heroin today is about 7 to 10 times more potent than it was in the 1970s. So that sort of tells us what we're dealing with. The fentanyl, it's estimated, is 30 to 50 times stronger than heroin. And the carfentanil, 100 times more stronger than the fentanyl. And one of the things that we did a month or two ago, we started seeing this carfentanil appearing across the state of Ohio. And one of the things that we immediately did is send out a bulletin to every department in the state, warning them that this is out there. And our strong suggestion is, do not field test this stuff. If you don't know what the substance is, deal with it with gloves and treat it like the dangerous thing it really is. This carfentanil, you don't want to touch it. It's just horribly dangerous. The fentanyl cases that we get in the Attorney General's office in our crime lab. 2010, we only had 34 cases. 34 cases. Last year, we had 1,110 of those cases. We are on track to exceed that this year. And of course, now you have to throw in the carfentanil as well. Let me just describe the problem statewide. And I think you all know what it is pretty much in Southwest Ohio, but it's everywhere. It's different than any drug epidemic we've ever seen, or at least that I've ever seen in my lifetime. And I started as a county prosecutor in the 1970s. And what's different about it, I think, is everywhere. And it's every demographic. It is not really one particular group that's taking it more than others, and it can be any age. While I often talk about, when I give speeches and warn people about the problem and talk about kids, Fran and I have 8 kids, we have 22 grandkids, so we're sort of focused on kids. But the reality is that it can be any age. If you ask me what's a typical person who is taking heroin in the state of Ohio, I would say, well, look, we really can't say that because it's the face of Ohio is the face of heroin. But if you forced me to and said, okay, give me a group, describe the person, I'd say 35, white male, lives in the suburbs. But it's everywhere, and we've seen the tragedy. We had a couple of weeks ago conviction of a mother and a grandmother for giving the grandson drugs. We've had cases where mother and father have lost their child because they're both addicts. They go in to visit the child at Children's Services, and they both overdose right there. I mean, you cannot make this stuff up. So when people say, well, how bad is it? I say, well, however bad you think it is, it's worse because that's what we're seeing. And it is everywhere. It's more likely to be in the rural counties, frankly, than it is in the suburban counties. But it's very much so in the suburbs, and very much so in the cities as well as the rural areas. There's no, I don't have a good answer, but I'll note a couple things. One, we think about 3/4 of people who are on heroin started on pain meds. About 10, 15 years ago, we had a couple things come together in regard to pain meds, in regard to would indicate why this is becoming a problem. First of all, doctors were being criticized for not dealing with pain. And there were articles that were being written and a lot of discussion about it. And so doctors started more focusing on pain. And that's fine. There's nothing wrong with that. If you have pain or if I have pain, we want our pain to be dealt with if it can be dealt with. But at the same time, the drug companies were developing these new pain meds, the opiates. And they were putting millions and millions of dollars behind not only advertising, but in reaching out to doctors and telling doctors that it really was not very addictive. And so those two things came together, and we saw this massive spike in pain meds. We have slowed that some in Ohio. We're down from the peak as far as what is prescribed. We took the licenses away of about 100 doctors, but we still have a culture problem out there. We still have some doctors who are, kid goes in, 18-year-old goes in, has wisdom teeth, and the doctor writes a script for 30 pain meds. So we still have a culture problem. But that's number one, I think. Number two, we've had a culture change in regard to the people who are doing drugs. When I was a county prosecuting attorney, we would expect to find heroin maybe in Dayton, the cities. That was our big city closest to us. We wouldn't expect them to find it in our county. And the people who were doing drugs, most of the people who were doing drugs, crazy stuff they were doing, but they wouldn't do heroin. There was a kind of a psychological barrier there that stopped them from doing heroin. You'd get to know after a while in a county our size, the drug dealers and some of the people who were using drugs. Sometimes they'd actually talk to you, and sometimes they'd tell you the truth. So, sometimes I would say, hey, Charlie, what are you doing? What kind of drugs are you doing? I'm doing this, I'm doing that, I'm doing that. Okay, are you doing heroin? No, come on, DeWine. I don't do heroin. That's crazy people do that. I wouldn't take that needle and put it in my arm. It's crazy. So there was a psychological barrier. Okay, that barrier is gone. People who are taking drugs, that heroin, at least for the ones who are doing heroin, it must be just like any other drug in their mind at least. So that psychological barrier is down. I think somehow we have to resurrect it and bring it back. And the third thing that has changed is Mexican drug cartels are really good at what they do. They grow the poppies in Mexico. They make it into heroin down there. They transport it across our southern border. They bring it into Ohio, bring it into our major cities, out from our major cities, throughout the state. They control it until you get right down to the street level. And they're the ones who are bringing it into Ohio. And there's a perfect business model for the people who are selling it. Why is it a perfect business model? Well, they'll bring it to you. They employ what I call the pizza delivery system for what a pizza costs, and if you don't get too many toppings, for what a pizza costs, and as quick as you can get a pizza, they'll bring it to you, or they'll bring it more likely to a Walmart out in the parking lot, or McDonald's, or Wendy's, or someplace like that. So they're all about service, and they also know that as people go along, what starts as a $15 a day habit may end up as a $1,000 a day habit or a $1,500 a day habit. And they've even been known, of course, to give the stuff away to try to get someone addicted. So I think all those things coming together are at least a partial explanation of why we have this problem. What's the solution? We're not going to get rid of this problem overnight. And our much as we would like to, we can't expect to see it go away overnight. But I truly believe that what we can do is save lives, and I think we are saving lives. And so I just commend all of you who are here today for the work that you do, our first responders, our people who are involved in treatment. You all are playing a very, very crucial role. Let me talk about a couple things I think can be done. I put together, along with Speaker Rosenberger and Senate President Faber, a group of citizens, diverse group of people, and asked them to come back before the end of the year with recommendations in regard to education and prevention. I think we have to get in front of this problem. And education and prevention is probably the most important thing that we can do. I served on Ronald Reagan's National Commission on Drug-Free Schools in the 1980s. every expert who came in told us the same thing. If you're serious about prevention, if you're serious about education, you got to start in kindergarten and you got to go through grade 12, and you got to do something every year. And every year you have to do something that's age appropriate and something that has a scientific basis behind it, that it shows that it does actually work. You know, we don't teach anything else the way we do with the drug problem. You know, where we sometimes wait till the 5th grade to start something, and then we skip maybe to the 9th grade or 10th grade. There's very few places in Ohio where a young person who's growing up will get impacted every single year in regard to this message. And so I think we have to do this, and I'm going to continue to talk about it and to push for it. Our group is going to come back in probably in late December with recommendations, and then we'll have a debate in this state about actually trying to get serious about this problem and getting in front of it. Second thing, I just want to commend Coleraine and Norwood and other police departments. I know there's several others who are doing this rapid response. The sheriff up in Toledo is doing it. It's a positive thing. And the data that I have seen shows that we're saving lives, you're saving lives. The departments that are getting involved in something that 10 years ago none of us ever would have expected law enforcement to be involved in. We never would have expected law enforcement to be involved in trying to get people into treatment. But it's necessary today, and my hat's off to all of you who are involved in that. Any department who's not doing it, you want to look at Coleraine or look at Norwood or look at some other communities that are doing it. I'm sure they'll be happy to help you and try to put together a similar program. So I think that clearly works. We do what we do in the Attorney General's office in regard to law enforcement. We have the state crime lab. We also have special investigators. We will come out and work with your department to try to get the bigger drug dealers. This is probably more important to the smaller departments and the mid-sized departments than it would be, for example, Cincinnati Police Department. But for those smaller departments, we've got a unit, and we can't talk about it publicly in a public meeting, but we've got lawyers who will come out. We've got equipment they'll bring with them, and we've got agents who will come out to help you try to get the larger dealers once you've already started your investigation. So that's an offer. Finally, I have noticed as I travel around the state that the communities that are really making the progress are communities where it's gotten so bad, they get so sick of seeing their kids die and their friends' kids die, that they kind of rise up in a grassroots effort. Those grassroots efforts actually work. Doesn't save everybody, doesn't get rid of it completely, but you see a change in the community. And part of it is recognizing, yes, we have a problem in our community. And two, we need to inventory what our assets are. What do we do for treatment? What do we do for prevention? Who's doing different things in the community? One of the things I found is communities many times, until you get together in a town hall meeting, they don't know what one group doesn't know what another group is doing. So these grassroots efforts really matter. And so I have 6 people. I will introduce Amy O'Grady, who's up there, right over there. Take a good look at Amy. If you want to talk to Amy, she'll be here for the rest of the session. What we do is not tell you what to do, and we don't try to do it for you. But what we will do is come out and either do it on the phone or come out. If you want us to help you put together a town hall meeting in your local village or community, we will do that. Again, not to tell you what to do, but we're all over the state, and we have a pretty good idea of what seems to be working in some communities and what seems sometimes not to be working. Everybody's got to be on board. Now, it's got to be the business community, it's got to be law enforcement, it's got to be educators, it's got to be service clubs, and it has to be the churches. Got to get the churches involved. They have to be part of this. Whether it's a synagogue, whether it is a Catholic church with a priest, or Protestant church with ministers. It's a very lucky minister who has a congregation that has no one in that congregation who has not in some way been touched by the opiate problem. It's a rare church, rare community. So pulling everybody together. We'll help you do that if you want us to. I know there's a lot of good things going on in Hamilton County, a lot of good programs. And I'm not here to tell you that you should stop doing what you're doing. You should continue to do that. If you need any help, we're there to help. If not, continue, go get them and make a difference, because these grassroots organizations truly work. Naloxone, look, I favor the use of naloxone. First responders carry it. Many police departments are carrying it. What we're seeing in our rural counties particularly is it's important for the police to carry it, because it depends on where the overdose occurs. You may have a sheriff's deputy who can get there quicker than the first responder. Probably not as common in a urban area, but certainly in the rural area. So we encourage police departments to carry it. One of the things that we have seen is that with this carfentanil and with fentanyl, but particularly the carfentanil, it just is harder and harder to bring someone back with naloxone. I'm sure some of you have had experiences here. I talked to somebody the other day, and he said he used 8 cans on somebody before the person responded. So again, this is a moving target that we are seeing. Well, let me just conclude by saying, I'm an optimist. My wife Fran says anybody with 8 kids by definition is an optimist. So maybe Fran and I are optimists. We're also crazy, but I'm an optimist. And while I truly believe this situation continues to go downhill, I don't think we've bottomed out yet. But I also see an awful lot of good things going on, and some very, very dedicated people who are saving a lot of lives. And so, all of these things coming together, education, we hope that we will get moving so that every kid has that background. Everybody who has an addiction will be able to have treatment. A lot of it is not only inventorying what assets you have, but figuring out how to link that person in, which is where the rapid response teams do such a great job. So I think we've got a lot going on, a lot of good things going on, but we have to keep pushing and we have to keep trying. And I think working together, we may not get rid of this problem overnight. We're not going to, but we will, in fact, continue to save lives. And so thank you very much for doing this. I look forward to the panel. Thank you.
At this point in time, we're going to move it over to some question and answers. We have a panel that has come to maybe answer any questions you might have. Members of the panel are going to include Tim Ingram. He's the health commissioner for Hamilton County. If he could go ahead and step up. Obviously, we have Attorney General Michael DeWine. Dr. Samarco, who is the Hamilton County coroner, was unable to make it today, but Justin Weber, which is an investigator with Hamilton County, will come up and assist in the panel. We also have Chief Rich Wallace with the Amberley Village Police Department and one of the coordinators for this event. He currently serves as the village police chief and fire chief, so he wears 2 different hats. And we like to make fun of it that, he didn't know what he wanted to be when he grew up, so he decided he wanted to be a hero and a bad guy. Cops are bad guys, so thanks for coming up, Rich. And then it's a family affair with these guys, because then it's Chief Ron Wallace, who's the Norwood fire chief, who is also Rich Wallace's brother. So we got 2 fire chiefs in the room who are related. And then myself is also on the panel. So if you gentlemen can go ahead and take your seats. We have microphones up there. We also have microphones that we can come out to the audience and make sure that we answer any questions. Is Tom Fallon here still? Okay, come on up, Tom. Tom already spoke today too. All right. This is the time where you're not bashful. Raise your hand if you have a question or a concern. We have people with mics and they'll hunt you down. If not, then I'm going to have to sing and maybe break dance or something in front. So please, feel free. There's a question right there.
I'm just
curious as to why the heroin is mixed with fentanyl and then the carfentanil. I don't understand that. Is that to get a greater high, or what's the purpose of that?
Is to get a better high. If you talk to folks that have this disease of addiction, they're always chasing that first high. And the fentanyls are much more powerful than the heroin alone. And so clearly we're probably witnessing a pivot point in street drugs in our society at this time.
I think the other thing to keep in mind is the people who are selling this stuff are good salespeople, and they're always trying to provide a better product. And what the irony is that we know that, you know, with the fentanyl in there is much more dangerous, but apparently, you know, some of the addicts are willing to take that chance, chasing that additional high, and so it's very counterintuitive. It's exactly opposite of what you would think. But these guys are always trying to do something different. I think the other thing you're seeing that I'm told is that it you know, it's a lot cheaper to produce the fentanyl than it is to grow the poppies in Mexico and turn them into heroin.
Thank you. This is from a medically assisted treatment standpoint. Speaking of sales, good salespeople, how do we go after like big pharmaceuticals? For instance, the Vivitrol program. I myself have had good experience with that, but yet it is highly, highly expensive. How do we attack something like that to where we could bring that price down, because that can save very many lives? Nothing against Suboxone or Subutex, but Vivitrol is a much safer alternative, and the success rate tends to be a little bit higher.
Yeah, I don't know of any magic way to bring these prices down. I mean, I'll tell you what we did within the naloxone. You know, we were able to get rebates, and that's something I did not mention when I was talking, but we have renegotiated it, so we're still getting those rebates, or can get those rebates. So if anyone is, you know, buying that stuff, you need to at least contact our office, see if you're eligible to get some of that money back. It's still horribly expensive, and it's still very expensive.
Hi, I work for a treatment center and I attend a lot of these different meetings around the communities. And one thing that I always see lacking is participation from the healthcare field. So I would like to know, do you have any planning involving them in more of a solution-based environment going forward?
Is on here. Well, UC Health is a partner in Hamilton County's Heroin Coalition, and frankly, they stepped up to the plate as it relates to healthcare's participation. And I think it's important for us all to recognize, and it was counterintuitive to me when you dig in from a local government standpoint, that healthcare really hasn't taken the lead on a massive health problem. And I think that a lot of that has to do with the stigma. Our hospital systems don't want to be involved in treatment because it's considered, I think, non-traditional. But you know, the Hamilton County Heroin Coalition, in cooperation with our partners and our treatment partners, are going to have to drive that conversation, because I think we're at a point in time now where people have started to look past the stigma and they recognize how devastating this has become. I had a good conversation with UC Health this week. I know that other major healthcare systems and insurance companies, who are a big part of this, are being brought to the table from the statewide level to be able to step up to the plate, because they really need to lead. And you know, from a government standpoint, we talk about how we respond to this. Well, once we figure out how our health community is going to respond, and it is delayed, I mean, I'll admit that, and I think that they would say the same thing, then I think it's incumbent upon the government's figuring out how we supplement their response.
just going to piggyback off Commissioner D. I would say to you that that healthcare would be a big part of the solution in this issue. And if you look back at history and look at some other, first of all, we all come to grips that this is a disease of the brain. If you look back in time and look how we first approached HIV infections and AIDS in the 80s, there seems to be some parallels going on with stigmatization and so forth with folks that have this disease of addiction due to opioid use. So although healthcare is actually part of the issue here, they can be a big part of the solution, and there's a lot of discussion going on in that area. As a matter of fact, I was at an in-service training today at Mercy Health with healthcare executives, which Dr. Sean Ryan, who is an addiction medicine specialist, was speaking. And it was very interesting to hear the dialogue among all the systems, healthcare leadership, about their role in this area. So it's really, I think we're starting to see some traction in that area, but there still is a lot more dialogue that needs to occur, and probably some continuous urging that they need to step up on this.
I'll also add that we've got a lot of different people in the room today that are with healthcare. Some very unique programs that are in the room. One program I had the pleasure of talking with during lunch was Angie Ferguson, who's the executive director of Drug Free Clubs of Ohio, which is actually in the schools and working in a partnership to deal with this issue, and also to offer resources, addiction resources and prevention resources to kids in the schools. So if you look around and you look at some of these name tags when we break for the day, I think you're going to see there's a wide range of people here that are willing to get involved.
Yep. Are there any hindrances to the investigation in regards to HIPAA, getting information from EMS personnel?
Without going into a long, drawn-out process about this, but EMS is kind of a stepchild of the HIPAA program. A lot of departments are not in compliance. We at Norwood found out a hard way that we had to rewrite our programs. One of the exclusions, though, has to do with criminal activity. So we make it a point, and I think all departments do now, you stage, if you go to an overdose run because it is a crime scene with a person using drugs, we have a police officer respond with us. They take information and take a report. So they're not really getting it from us from the EMS standpoint. They're actually getting the information from the police standpoint. So we are able to kind of cover over as a result of that. Good.
This question is for Mr. DeWine. Follow-up kind of to the question the other gentleman asked about the Vivitrol. We all recognize that the medically assisted rehab is much more successful in most cases than just going without it. How ready do you sense the congressmen and senators from the state of Ohio are ready to stand up and support with money those kinds of programs?
Well, I suppose it'd be better if you asked them. But look, I think any member of Congress who I've talked to, or senators, legislators in Columbus, everybody now gets it. I mean, this epidemic is no longer a secret. It seemed like for a while that the general public just didn't really understand the nature of this problem, how bad it is. So I think everybody gets it. I think what the key is now is making sure that our elected officials understand that the urgency behind this. If we walked out of here today, you turn out on WLW or some radio station, and they tell you that 8 people have been killed in a terrorist attack in Ohio. Imagine how we would respond. And then imagine if that happened the next day and the next day. I mean, we'd have the National Guard out. We would have everything. We'd be going crazy. And yet that's how many we're losing every single day. So, I think there has to be a sense of urgency. And, my recommendation to you or anybody else who cares about this is to make sure that, the legislators and all the other people in public office understand the urgency of this. But, they're seeing the same thing now that you're seeing. I think as far as, I'll go back and I'll make my pitch for education. I think we've got to get in front of this. I think that can be done fairly cheaply. I think the curriculum can be integrated into the current science courses, current health courses, without really a great deal of cost. And I think it's just a question of having the will to say we're going to do it, and we're going to do it everywhere in Ohio. So that's one thing that I think can be done without much cost. Treatment is not my field. I'm out of my area in this when we're talking about treatment. But I think the things that are going on in Coleraine Township, Norwood, and other places, Toledo, in trying to make sure people know how to get into treatment and encourage them to get in there is part of the problem. I think the other thing we have to look at is the availability, and that varies certainly by community.
If you look at Senator Portman's Comprehensive Addictive Recovery Act, that bill was passed with, frankly, with doctors driving the show as it relates to how funding was going to come to our communities. Ultimately, I know that the decisions that were made when that bill was passed were directed towards sort of rewriting how our court systems handle people who are in the system, and how the court system interacts with that treatment. And it's based upon the premise that medically assisted treatment is the real solution to this issue. So there is legislation, there is forward thinking on that from a federal level. I think that that's a tremendous step, and I hope that we continue that with Attorney General DeWine's leadership and other local leaders who are invested in this problem.
All right. Well, actually, we're right on time. It's 1:30, and we said we wanted to value your time today. Thank you for coming out, and we hope that you're able to have a takeaway from this and start conversations within your own communities. Again, a special thanks to Lumiere for sponsoring this lunch, and for all the representatives here, Lumiere Healing Centers. If we could give them a round of applause for giving us a nice lunch today. And also a thank you to Ramada Inn. They've provided this facility, and they can provide facilities for your event too. So you should go and talk to them at the front desk. All right? Yeah, I did get paid to say that. So yeah, get that hotel room ready for me, guys. All right, thank you very much. Be safe.